If you are wondering whether that runny nose, sore throat, sneeze, or cold could be allergies, just a cold, or potentially COVID-19, you're certainly not alone. I've got the tissues going here. And joining us is Dr. Mallika Marshall, who is keeping her distance. But sometimes people have all these symptoms. How do you tell them apart?
You know, it's really not easy.
Yeah.
We're seeing a lot of flu right now as well, so we can add that to the mix. But there are some distinguishing features that can actually help. So I want to start with allergies, because that's sort of the easier one.
Yep.
I mean, pollen counts are high, and there are a lot of people out there who are feeling the effects. And most people who are suffering from spring allergies have had spring allergies before, and they know exactly what their symptoms are. So if I'm in clinic seeing a patient, then I often ask people, do you have any itching? Do you have itchy eyes or itchy nose, itchy throat, even itchy ears? So if you have a runny nose and cough, but you're also really itchy and you've had allergies before, then chances are that's what it is. And most people with allergies don't have body aches and fever. If you have body aches
sitting here running my nose, I'm itchy.
But if you have body aches and fever, then it's more likely to be caused by an infection and not seasonal allergies.
I know, it's just making me itchy hearing you talking about it. But that is a good tip off. Let's put seasonal allergies aside, because as you said, I think people who suffer from them know it really well.
Yeah.
Can you distinguish between the common cold, the flu, and COVID-19?
Okay, so this is where it becomes a little dicier.
Okay.
Because they're all caused by respiratory viruses. It's easier to tell the difference between the flu and a cold. So for example, people with the flu, they often feel pretty sick.
You should lie down.
Yeah, exactly. They feel like they've been hit by a bus, especially if someone hasn't been vaccinated before. They might have fever and body aches and fatigue and a bad cough. The common cold can also cause a bad cough, but it usually doesn't knock you off your feet like the flu does. The problem is, how do you tell the difference between the common cold, the flu, and COVID-19? And that can be really hard because COVID-19 can mimic all of the above, basically. So it can present as a simple cold, or it can make people feel like they have the flu.
All right, so what should you do if you have the cold or flu-like symptoms?
So I would say if you have a sore throat and a stuffy nose and cough and body aches, fever, any of those, then you really should get tested for COVID-19. You could do a rapid antigen test at home, or you could get a PCR test in a clinic. And if you're doing home testing, then I suggest you do several tests over a number of days to assure yourself that you actually don't have COVID. There are treatments available.
You get treatments?
Exactly. So we now have treatments. Well, for the common cold, it's really symptomatic treatments, over the counter, fever reducers and decongestants and things like that. But right now, we actually have decent antiviral medications available by prescription, oral medications we've had them for a while for the flu, but we also have them for COVID-19 as well. So if you test positive for COVID-19 or you suspect that you have a flu, then I think you should call your doctor. Let them know how long you've been sick, what your underlying medical problems are, and chances are you might walk away with a prescription for an antiviral medication if you either have the flu or COVID.
And those antivirals really work.
They do, and they're really keeping people out of the hospital, which is what the most important thing is.
What we need. So at this point, what is the best way to protect yourself from all of these illnesses?
All right, well, so it's probably not surprising that all of these illnesses all of a sudden have started to rear their ugly heads because we've taken off masks in the past few weeks. I mean, you go out and rarely do you see someone with a mask. And so how can you protect yourself from these things again? Put a mask back on. I know a lot of people don't want to hear that because we've enjoyed some of the freedom, but we're seeing an uptick in cases of COVID. We're definitely seeing a lot of flu out there. We're seeing a lot of colds out there, and even allergies. Wearing a mask, if you have allergies and you go outside, a mask is really going to reduce your exposure to pollen and reduce your symptoms.
That is certainly true. And now the CDC today extended the mask mandate on public transportation for another 2 weeks. So clearly, I think a lot of people are making that choice on airplanes or trains.
I have to say, I was happy to hear that.
Just for a little bit longer.
We'll see.
Dr. Mallika Marshall, thank you so much.